Welcome. If you guys are doing all right, my name is Dr. V. Sang, just using this platform to be able to answer questions regarding the heart and regarding your health overall. So if you have any questions, leave it in the comments and I'll do my best to answer it. The first question that I have for you guys is, can you hear me okay? If you can hear me okay, leave me a message in the comments and we can get this started. The volume looks like it's on perfectly well, so. Carol Hillman, hope you're doing well on this Sunday. So welcome. Hope you guys are doing well. Dr. E saying here to answer questions regarding the heart, regarding your health, and just overall things that you need to watch out for. And the reason that we do this is because prevention is a lot better than treatment. So what does that mean? That means that if you understand what the risk factors are for something like a heart attack or for a stroke, you can potentially prevent that from happening with carefully watching your blood pressure, watching your cholesterol level, watching your diet, watching how much salt you take in. Understanding all of those things play a huge factor in your health, especially when it comes to blood pressure and diabetes. Unfortunately, those are the two biggest risk factors for things like a heart attack. Things like strokes, things like heart failure. So if you understand this now, you can potentially prevent this from happening in the future. And the biggest thing that we see is that a lot of people will say, so and so, their father, their uncle, grandmother, aunt were healthy their whole life, and then they came in with a massive heart attack and unfortunately, passed away, and they're left confused as to what happened since they've been healthy their whole life. In reality, some people were not healthy their whole life. In reality, they were probably hiding something that they didn't even know about. They were probably hiding heart failure for a long time until the body could not take it anymore. The body will make changes to try to accommodate, especially with things like heart failure. And then it comes to a point where it can't anymore. And then it begins to fail. And that's when people go to the hospital because they're having heart failure-like symptoms. Jordan says, what can pain under the left rib be? Only when I slightly press it with the finger. That sounds like musculoskeletal, not cardiac, but either the muscle or even the bone itself may have been bruised. But, we get concerned when someone has pain, maybe in that same area, but it's only when they exert themselves or when they're stressed. But not necessarily if you push on it. If you push on it, it's more musculoskeletal. It's more due to the muscle or due to the bone or due to the cartilage. Sometimes they still need appropriate recognition and evaluation by your medical provider. Yeah, I wouldn't say medical advice, more just talking medical. You use the word medical advice. There's some legal stuff that goes into it. So it's just me sharing my knowledge as a cardiologist about what I see on a daily basis. That was a good question, though, Ezra. I get a lot of palpitations with coffee, so I'm switching to tea. Doesn't taste the same. But if you guys have any questions, feel free to ask away, and I'll do my best to answer it to the best of my ability. Like I said, prevention is going to be one of the biggest things that we can do when it comes to our health. Understanding that blood pressure plays a huge factor, diabetes, cholesterol, physical inactivity, exercising, watching the amount of salt content that you take in. Family history and genetics play a huge factor into it too. So putting all of those together is going to be one of the biggest things. But also being consistent and following up with your medical providers, especially if you have any underlying health issues. UK is in the building. Jordan, thank you. And have a good workout if you haven't worked out already, if you haven't worked out yet. How long does the sternum area heal after surgery? For each individual is different. Typically, we don't want people doing anything that can cause damage to that area, especially after acute surgery. Some people will say no heavy lifting for 2 to 3 months, and then after that time period, you can start incorporating really light weights. I'm talking about 5-10 pounds for a month, and then slowly increase it over time. Some surgeons have said that it can be, half a year for it to get to, 50, not 50, half a year for it to get to like 80 to 90% of it. Typically, it's a long process, but those first 1 to 3 months are the most crucial that you want to lay low, and that's why one of the biggest things after those sternal procedures, any type of surgery that involves cracking the chest, cardiac rehab is very beneficial, so they can assess and see what you need to do at a increment, and then getting you where you need to be and kind of giving you a workout plan from there on. That's a good question, Jerry. You're welcome. You're welcome. Keep the questions coming. I'll do my best to answer it. One of the things I'll talk about, just because I know it pretty well, is high blood pressure. High blood pressure is probably one of the most crucial things and most commonly talked about thing, especially from my channel, is because the other name for it is a silent killer, because a lot of people have high blood pressure and they don't know that they have it, because high blood pressure typically doesn't have any symptoms unless it's really high. 170s, 180s, it can have headaches, but people can have high blood pressure for multiple years, decades, and then over time the heart gets bigger, because the higher the blood pressure is, the harder the heart has to work. Heart is a muscle, so it'll get bigger, called hypertrophy, and then this can lead to heart failure eventually over time. A lot of times people will have heart failure for multiple decades, and then they go into the hospital for their first episode of heart failure, because they haven't been treated and they didn't know they had high blood pressure. Yeah, I'm doing well. I'm doing well. I'm gonna give about 2 more minutes, answer any questions if possible, and if there are no questions, I'll hop off of here and probably be back later tonight, between 9 and 10 p.m. Just answer any questions people may have. Okay, they got me with that one. Why is blood pressure so low after surgery? I mean, blood loss. If you think about it, a lot of times it's a pretty big procedure, and you've lost a lot of blood throughout all of it. So, blood loss is going to be one of the biggest things. And when you're having anything, whether it's surgery or sickness, your body will release certain chemicals to help fight it, and those chemicals can also dilate the blood vessels, which can lead to low blood pressures. That's my cue. Kids are up and acting crazy, so you guys be blessed. I'll be back later in the afternoon to talk about anything regarding the heart and the health. All right, peace.